Planet Vero Studio is powered by the Nolan Group of RE/MAX Associated Realty. MyNextHomeFinder.com.
Welcome to Treasure Coast Community Health. We have 8 locations to serve you better. Our staff is dedicated to help you and your family. Here's your host, Vicki Soule.
And welcome to Community Conversations. It's so nice to be back again this week because the weather is beautiful. It is the epitome of Florida winter weather. 70, 75, cool nights. Just can't get any better than that. So it's a delight to be here. I know that a lot of folks that are visiting us for a shorter time than all year round feel the same way. And so I'm going to use this time today to inform about another organization that we couldn't do without. We know that this community is great for partnering, particularly among the nonprofits, because we all feel like we have just a little piece of making our community special. And so today, Andrea Berry from Healthy Start is here, and you've brought your new colleague with you. So I'll let you introduce her.
Christina Cassell is our new development manager. We're so happy to have her.
I'm so happy to be here. Thank you.
So I won't put you on the spot right away, Christina. I'm going to pick on Andrea instead because Healthy Start is both a national and a local organization. Is that correct?
That's right.
But in Florida, does it look the same as every other state? Because I found that Florida is very unique. We might have the same name or the same mission statement, but how we carry it out sometimes is different.
Yeah, that's a great question, Vicki. Yeah, Florida is unique. If you haven't noticed that, for all those that are visiting, it's not just the weather.
Nope.
We are definitely unique in Florida for Healthy Start. So Healthy Start was created actually in 1991 by the governor at the time, whose daughter actually had a preterm birth, and they almost lost their grandson. So he started to really look at what was going on with infant mortality in the state of Florida. And what he found was that we were very high, especially compared to other states. And he started to drill down on that to try to figure out, like, what's going on? How is this happening? And what he found was that in each area of the state, we had our own set of causations, strengths, and weaknesses. And so rather than just blanketly saying we're going to do A, B, and C to do this statewide, he said, I'm going to empower the local coalitions, local areas, to form these Healthy Start coalitions. And they'll be in charge of assessing what's going on with maternal and child health and filling gaps and leveraging strengths of each community. So in Indian River County, we're very lucky that we had a group of people that took it upon themselves to say, you know what, we need to protect babies and families in this community. And so they formed the Healthy Start Coalition. So we're 30 years going strong. Wow. Of serving this community, and it is our job to prevent infant mortality and fetal death and maternal mortality, and to ensure every family has the ability to create that healthy start for their babies.
And that's so important because as we're finding out more and more in these 30 years that have passed, that foundation, even in utero, carries kids through their lifetime in very positive or not so positive ways. And that's assuming the premise that you started with is that we're saving them from the things that used to kill children.
Yeah, that's right. And we look at, and Vicki, you're such a good partner to us because you and Dr. Moore, your medical director,
yes,
participate in our fetal infant mortality review. And it's such a hard experience to do that because we take every death of every baby and for every family that has a loss, and we look at the medical records. We try to interview the families to find out what really happened and what could we as a community have done better to serve those families and potentially prevent that death systemically. And you guys sit on that, and so that's what we do. We look at that and then we say, okay, how can we change this? How can we do this better? And, some of it is very A to B and some of it's a little more social determinants of health, right? That's why you and I work on the literacy initiatives that we work on, trying to, broaden what we think of as what helps health, right?
Exactly. Yeah. What kind of milestones should these children be reaching, not just for shots and other health-related things, but what kinds of things can parents and community members do to accelerate that ability to read before they hit third grade, so that after that time they're really working to learn a whole lot more. And, you know, I'm an old person now, I guess I have to say, because when I think about what we had to do in kindergarten versus what my children had to do 40 some years ago, compared to what the children now are expected to be able to do, is a result of all the other learning capabilities that we have. You know, after sending a man to the moon, I mean, there's all kinds of things that we didn't know scientifically or economically, forestation, you know.
Yeah, we can help.
All those things.
And that's what Healthy Start, one of the things that we identified was, you know, education and literacy. And so we help parents to learn how to even read bedside after baby's born. We present them with a book. And and the book is not just a story, but it actually has on the other side of it how to engage baby and how far they can see, you know, so, and how to, you know, hold the book in a certain way and
Really?
look them in the eyes. And we do that.
I was
from
just
bedside.
engaged in the story apparently when I come through it. But you're right. You know, some of those we didn't know at all when we were raising children a long time ago. And some things were passed on by our grandmothers, our mothers, our special aunts, and those folks that now they're working or they live in another state. You know, the communication is really hard. And so who fills in that gap? And it's great to know that your Healthy Start staff, didn't think I could get that one out.
That was good.
Are doing those things.
Yeah.
So coming back to the infant mortality review, what kinds of gaps? You've only done it a couple of times. It's an emotional thing to have to go through. But what kinds of lessons and gaps have you found in doing that? Yeah.
So the top causations of infant and fetal death are pretty consistent throughout the United States, and most of them, especially with infant death, have to do with preterm birth. And preterm birth has a lot to do with preconception health and things that you work on at TCCH. But another big one is sleep-related deaths, and that's something that we've really zeroed in on a lot this year. We each year have some deaths related to sleep, and that whether it's SIDS or, unfortunately, the medical definition also being strangulation, suffocation, and those are very hard cases, and so we always look for innovative ideas on how to approach this, because right now, Healthy Start, even when we said we give away that book, another thing we give bedside is a onesie, a little cute little onesie that says "this side up." Tells mommy to have, you know, put baby down, sleep on their back, and we talk about safe sleep. We talk about, you know, what the evidence shows now, and the best way to keep babies safe when they're sleeping. But still, even though we're hitting every family in the hospital, we still have, you know, some unfortunate events. And so we look at innovation. And so one of the ways that we're trying to address that now is the DOSE program, which is a program it's from actually Broward County Direct On Scene Education.
DOSE.
Yes, DOSE.
Okay.
And I'm going to have Christina tell you a little bit more about that program.
Yep. So at the end of this month, March 28th and 31st, Healthy Start has partnered with Indian River County Fire and Rescue, and we are sponsoring the first DOSE training. So they're going to come up from South Florida and train our fire department and emergency responders when they are on a call. So not necessarily related to a baby, but you know, dad's not breathing or something's happened. So the emergency responders go to the home and they're trained to first check to see, is there evidence of a baby? Does blankets, or does it look like a baby might sleep here sometimes? And two, is there a safe sleep space? So if there is a sleep space, but maybe there's pillows or things in the sleep space that could potentially be hazardous, they'll be trained to identify what is a hazard and to remove it. And if there is not a safe sleep space for the baby, then they'll provide that for free to that family. And Healthy Start is going to be providing those for the emergency responders.
That's wonderful because it sounds so easy, buy a crib. Well, I had sticker shock the last time I walked through a furniture store. It's not that easy, and particularly for folks that are struggling with evictions, sometimes they have to leave their furniture, even if they had a crib.
Yep.
They don't know where they're going. They end up in their car for a while. I mean, there's all kinds of sad stories that are happening these days in terms of young families and the inability to find another place to rent if something happens with their existing. So I'm just amazed at how this has flipped over the years, because we were always taught to put our children face down. And now we're flipping them to the side up.
It's so funny how evidence changes, but that is what the evidence shows is that it's a better position for baby to keep breathing all night. And what I love about this collaboration, Vicki, is my husband is a firefighter, and so I know that he often talks to me about going into homes and seeing things that he wishes he had a remedy for. Now, they are obviously busy, and they're usually saving lives, so they don't have time for a lot of, conversation. But it's always nice to have a solution, especially when you have, the firemen go out on calls where they see things, and many of them probably have seen sleep-related deaths. I mean, we always, in the FEMA, we talk about when they get on scene, what they see, and they record. And so if you have a solution for that you can provide to the fire department, and it says, okay, well, if you're seeing this as a preventative measure, you can have that conversation. And the gentleman that invented the program, the Broward Fire Captain Carroll, Captain Carroll, and he talks about that and how he felt so empowered by having the ability to prevent this instead of coming face to face with it in the future.
Absolutely.
So they can do that work, and they're so trusted. They're so trusted as someone in their home that's helping them with their health and helping potentially transport one of their family members. They're trusted.
That's wonderful use of the resources. I know that we've had EMS have to come to our house because we've had elderly relatives, and they don't know what they're going to encounter. So oftentimes we'll have 2 or 3 or 4 when it really only takes one of them to do vitals, and the others are looking around. So it's a perfect time to be able to do that education.
Yeah.
Speaking of perfect time, we're going to take a short break word from our sponsors, and then we'll be right back. The new year is underway, and it's time to schedule your annual physical. This quick, comprehensive visit can uncover diabetes, high blood pressure, and even cancer, ultimately saving your life. Treasure Coast Community Health waives Medicare deductibles and offers a sliding fee scale discount, so everyone can afford to take care of their health. We can't fix what we don't know. Let's work together to make a healthier community. Call us today at 772-257-TCCH. We're a nonprofit.
Who's got time to clean? When you need it clean, call Germ Wizards, LLC. Using the most up-to-date equipment, Germ Wizards pays strict attention to detail. They make dust disappear. Whether you need your office to sparkle, your home to shine, or you want to give someone a great gift, hire the Germ Wizards. It's easy to get a quote online. There's even an online portal to discuss details directly with your cleaning professional. Visit GermWizardsLLC.com. Make dust disappear with Germ Wizards.
This is iHeartMedia's Treasure Coast Connection.
The Treasure Coast Connection is brought to you by New Vision Eye Center.
Come out and support Do You Give a Ruck second annual Army versus Navy Battle for Dominance. 5K, 18 obstacles, one mission to raise money for the Coalition for Attainable Homes. Bring your 2 to 4 person team or sign up as individuals. Choose Team Army or Team Navy and attack the obstacle course. Enjoy giveaways, live music, beer tent, food trucks. Bring your rucksack or backpack with donations, non-perishable foods, hygiene supplies, or baby items. Do You Give a Ruck second annual Army versus Navy Battle for Dominance at the Florida Tech Challenge Course in Fellsmere, Saturday, April 2nd from 10 to 4. Early registration online at runsignup.com or doyougivearuck.com or find us on Facebook.
Call New Vision Eye Center for a consultation or second opinion. Your eyesight deserves world-class eye care. Visit newvisioneyecenter.com or call 772-257-8700.
And welcome back to Community Conversations. If you're just joining us, my name is Vicki Soule. I'm the CEO of Treasure Coast Community Health, and our primary job is to provide primary medical, dental, behavioral health, or other primary care services that allow a comprehensive look and response to your needs. And today I have with me, very happily, since we're sort of neighbors right across the hall, Andrea Berry from Healthy Start, and her new, if she sounded new, she is, Christina, their new development director. And we've been talking about some of the more recent things that your group has done through Healthy Start. The femur, the
dose.
The dose, thank you. All these new acronyms.
There's a lot of acronyms.
There are. In healthcare, there's always a lot. So we won't go back through those. But during the break, I pointed out to Andrea that they have a very vibrant group. And so I didn't want to lose the fact that the Doula Program is out there. And more specifically, when you talked about assessments happening for everybody that is delivering a baby in Indian River County, Healthy Start does an assessment and then offers services. But we didn't talk about anything after that. So I don't want to leave that part hanging, because that's a major part of how you impact new moms and families in the community. So tell us, if someone came up as they could use more services on their screening assessment, what happens then?
Yeah, so our whole goal at Healthy Start is that, we know that parenting is difficult and that everyone needs a little bit of help. It just depends on where you are on the spectrum, right? Everyone could use a helping hand of some sort. So when we talk about when we do our assessments with each family, and if someone's really struggling hard, they are, having a lot of anxiety about being pregnant, or they, are in a relationship where there's intimate partner violence or there's substance misuse, they're going to be a little bit higher on the spectrum, right? So we're really going to give them a lot of intense TLC and try to help them to get whatever they need. And they could be lower on that spectrum. They're just concerned about childbirth. They're just concerned about breastfeeding. And so wherever they land on that spectrum, we're going to be able to help them. And so we have so many programs that really are tailored to whatever's going on in your life. So you mentioned the Doula Program. I love our Doula Program, our community Doula Program, which pairs moms with a local community member who we have trained, and we pay to support that mom prenatally and during childbirth and then postpartum. And we have our Parents Teachers programs, which helps every mom, every family to learn how to be their child's first teacher. So we go into the home, we sit on the floor, we talk to you about how to use, simple, inexpensive tools to really help build your baby's brain to be a superstar that they are. They are superstars, every one of them, right? And they just need the opportunity to show it.
And again, if you haven't been around other moms with new babies, I mean, you've got this crying, pooping thing.
Yes. That's right.
What do you do to make a dent in forward visions?
That's right. But also, Vicki, it's a good thing that you even bring that up about being around people, because during the pandemic, we have all been so isolated, especially new moms, because they are afraid. A lot of them are afraid. And moreover, there's been less activities, right? There's been less play groups and things like that. So a lot of moms right now are having trouble assessing where their child falls. And that's often how we as parents kind of figure out if our kid is doing the things it should be doing. We sometimes know the milestones, but oftentimes we're looking at their peers and saying, oh, wow, Johnny's rolling over. And it shouldn't be a comparison. And you should never really judge your child based upon other children. But sometimes that's how we start to become aware, I should talk to my pediatrician about that. Mm-hmm. But that's what our programs are able to do. We're able to empower parents with assessment tools, simple, ASQs that they can do with their children, or we can help them so they can assess and say, okay, you know what? This is an issue. We should have been on this target. I am going to talk to my pediatrician about this, because early intervention is the best way to take care of these issues. Mm-hmm. And identification is how we do that. And by being isolated and sometimes not even mentioning them. Sometimes they don't mention them during pediatric
absolutely.
visits.
often freeze up. They feel foolish, especially first-time moms, but even experienced moms that might have had a child or two before. If this child is different, sometimes ignorance is bliss. We tell ourselves, each one of my children is different, and it's okay that whatever's not happening isn't happening.
And you shouldn't be hard on yourself, and you shouldn't beat yourself up, but you should take the opportunity to talk to your pediatrician about it, because if you do identify something that you can, like, for example, we have simple activities that we can give you that will help move those milestones along. And sometimes it's just as simple as routing that baby's brain, right? Getting it while it's early, while it's firing, and gosh, their brains are growing so much. Yeah,
absolutely. And so you have nurses that will actually go into the home.
We do, and we're back in the home now. I'm so thankful to report. Oh my goodness, so it's so many. We have such great staff at Healthy Start, and they were all dying to go back into the home.
Sure.
I mean, not all of them, but most of them were they missed it. It's different to be just like we all miss, kind of like I'm sitting here with you. It's different to be on a Zoom or be on,
absolutely,
and to be in a room with a family and to be able to really.
So if in the initial assessment, say we've got a mom or a grandmom out there that's listening, and the baby's now 18 months to 3 years old, and the original assessment didn't include some more intensive support from Healthy Start, but they think that maybe they could benefit from your coaching, from your nurse visits, from those things that Healthy Start does, could they reach out now and call you?
Absolutely, 100%. We take self-referrals and community referrals, and any way that you want to get in touch with us. And I guess I should just say our phone number, which is 563-9118. Yeah, that's right, 9118. And then we have the guide will prompt you through to reach our maternity navigators, who will help you to get connected to whatever you need, and that is really it might not be Healthy Start that you need. You might need something else. You might need to get connected with WIC. You might need to get connected with a mental health provider. Who knows whatever is going on in your life. But really,
you would help them with that discernment and connection.
Yes, we want to be able to help you to get whatever you need to be the best parent you can be.
And that's what it's all about.
Yeah.
We're all imperfect. We learn a lot, but I used to tell my husband the first 2 years, we need a throwaway child because this poor thing is learning everything the hard way as I am.
You're building the most resilient children.
And he turned out that way, very resilient, wonderful man now. But I felt like everything I did was with my left foot.
I think we all felt like that in the first one, and by the second or third, you're kind of just like, we're doing this. We're just living through it.
Exactly. So I know that you had said while we were on break as well that you couldn't have done it without certain partners, and you wanted to name them individually. So you got a minute? Go, girl.
Oh my gosh. Well, with the DOSE program, we want to thank, of course, the fire department and the health department. Our partners there they always are such good partners in identifying what's going on in the community and helping us to get there. And they really did help us to help the DOSE program execute. And I always want to thank TCCH, Cleveland Clinic, and the hospital district. And I could go all day naming our partners, but there isn't an entity that touches families in this county that we don't partner with, and we have a great community. So I'm grateful for that.
Health and so many of these other things are so interrelated, and again, that's a change of silo thinking from 40 years ago, where don't get out of your lane. You're a teacher, you're a nurse, and so this integration, I don't want to say it replaces family, but it's a wonderful adjunct to having family that can help and guide and be there. So thank you very much for being there in our community, both of you. And again, tell that telephone number just in case anybody's wanting to call.
563-9118.
Thank you very much. And have a wonderful evening, and we'll be back next week.